This is the Cyprus News Digest with Rosie Haralambous.
On this week's programme, we discuss mental health as it's Alzheimer's Month.
The stigma is not just for Alzheimer's. There has been a stigma relevant to mental health issues.
And should we adjust our traffic lights because too many people are being caught unfairly for running red lights?
If they put this system on the traffic lights, I think that many of the fines, many of the violations won't happen.
Yesterday was World Alzheimer's Day, and indeed the whole month of September is designated as World Alzheimer's Month. So we're going to talk about something which is becoming an increasing problem across the globe, and that is an ageing population and dementia often getting very much out of control. Fofi Constantinidou, who's the director of the Centre for Applied Neuroscience at the University of Cyprus, is going to join us to discuss the problem. She's also a professor in the Department of Psychology, and Fofi, I believe you've also done extensive studies into cognition and ageing. And with, as I said, a global ageing population, this is something more and more people are coming across now, isn't it?
Yes, the number one predictor for changes in our thinking abilities, in our cognition, is age. So as our population grows older, then certainly there is a higher risk for someone to experience changes in their thinking abilities, such as memory, attention, language, communication, adaptive skills, emotion regulation, etc., because of either part of the aging process or because of a condition that can result into dementia.
Alzheimer's is something that we don't discuss much in Cyprus. There's still a big stigma attached, isn't there? And people tend to sweep it under the carpet. Do things like World Alzheimer's Day help us bring it more out into the open?
Yeah, I think there have been systematic efforts by advocacy groups, by researchers like ourselves at the Center for Applied Neuroscience to increase awareness and also try to help reduce the stigma associated with Alzheimer's. The stigma is not just for Alzheimer's. There has been a stigma relevant to mental health issues. And so the diagnosis of Alzheimer's is a difficult diagnosis. It's something that should be given when we have a more definitive data that point to the condition. To date, the only definitive diagnosis can be given actually with autopsy. So we talk about probable Alzheimer's diagnosis for most individuals. And so people sometimes don't know the difference between Alzheimer's and dementia. They also talk about the dementia that old people get as if it's normal for people to get dementia as they age, which is not. Dementia is a disease. And Alzheimer's is a major cause of that disease process.
It's interesting that you say that there is a difference between dementia and what I would say was possibly a fairly normal forgetfulness as you get older. So how should people look upon this forgetfulness? I mean, when do you decide, oh dear, I'm doing this far too often, maybe I should see the doctor?
Yeah, usually, and you're absolutely right, there are some changes that happen as we grow older. And the question is, are those changes happening in a gradual way? And as they're happening, I am adapting. So am I able to use strategies that are helping me to adapt, or are they happening at a rate and a frequency that interfere with my ability to perform my daily tasks, my hobbies, my different activities? And so, as a rule of thumb, we tell patients or people and families to look out for changes that make it difficult for a person to manage their finances, changes that are making it difficult for people to operate tools and machines that they normally are comfortable doing. Look for changes that result the person becoming more socially isolated. And those changes are not because the person has a physical problem that is making it difficult for them to move about and around the house, but it's because of there's something that is preventing them more at a cognitive or mental level. And if you notice those changes, and if you have concerns about the ability for the person to manage themselves, cook, bathe, be safe in the house, take their medication, then that means that there is something that we need to investigate further. It doesn't mean that it's dementia, but certainly there is a red flag that needs to be explored.
And how would a doctor diagnose dementia? I mean, are there specific tests? And I want to ask you whether or not people can do what I call brain gym to try and stave off this forgetfulness.
Right. So the cognitive health or good brain health involves a number of different things. And so in terms of the diagnosis, back to your first question, it's usually a team of experts that work together for the diagnosis. So we start with a primary care physician who is going to perform certain labs to identify or rule out medical conditions that might be responsible for the changes in thinking. So, for instance, somebody may have problems with regulating their sugar, or somebody may have problems with having very low vitamins such as B12, for instance. And those are things that can be reversed. Or maybe somebody has depression that affects their motivation and their ability to concentrate and remember. So we have to identify, determine if there are conditions that can explain this particular change. At the same time, in order to do that, you need to assess the person's thinking ability and mood and stress levels. And so that's where we come as professionals specializing in cognitive assessment and the neurocognitive study on aging at the University of Cyprus. We play that role. We conduct these assessments that are pretty in-depth. We assess memory, thinking, communication, language, we assess mood, and we determine whether the person's performance is where it needs to be for their age and education level, or if there are differences, and how significant are those differences. So that information, along with the medical assessment, and depending on those findings, then there needs to be neuroimaging, like a CT, MRI, to look at the structure of the brain, and then also looking at the history of the complaint, of the changes. How long have this situation been going on? What were the circumstances when we observed it? Then we can be led to a diagnosis of dementia, or maybe a more milder form before somebody develops dementia. Is what we call mild cognitive impairment, where there are changes that are beyond what you would expect as normal for their age and education, but it is what we call a prodromal phase to dementia. It's not dementia yet. It doesn't meet the criteria. So it's not a diagnosis that should be given lightly.
No, but if somebody is diagnosed, particularly in those early stages, are there things that they can do themselves to try and delay the onset of more serious issues?
Yeah, so there's two things. One thing is what the pathology, the medical disease that it's happening, that it's causing these problems. And then the second issue is the things that we see, the clinical picture that we see, the problems that the person and the family are facing. For the first issue, which is the medical condition, depending on the cause of the medical condition, if it's Alzheimer's, for instance, we know at this point we don't have a drug to stop the disease. But we know that in clinical practice, there are medications that are helping control the symptoms and delay the symptoms from progressing rapidly.
Those are quite new drugs, aren't they?
Well, there are some drugs that have been in practice for about 20 years that have to do with controlling symptoms. They seem to be more effective in the mild to moderate stages of the disease versus the more advanced stages of the disease. And that's why the timely diagnosis is very important. And back to when you talked about the stigma, the campaign should be prevention and early diagnosis, because when the diagnosis is done early, then the drugs can be more effective. And then at the same time, we professionals who specialize in neurorehabilitation can help the person develop strategies to improve their memory, to improve their language, to improve their communication. And so those strategies can be put in effect when the person is still able to learn and able to have control and improve their quality of life and their daily functioning.
In terms of physical things, am I right in thinking that Alzheimer's, in a sense, creates plaque in the brain channels so that the messages can't get through?
Yeah, one of the pathologies that are characteristic of the brain that has the disease is what they call amyloid plaques. And the deposit of those plaques are affecting the health of the neurons and the communication between neurons, because everything we do, a thought, a word that we produce, a movement that we make, it's possible because there is communication between the different brain cells, the neurons as we call them. And so when the messages between those neurons cannot take place, A, because the neurons are affected, they're diseased, or B, because the chemicals that these neurons secrete, the neurotransmitters that help with the transmission of the message, do not work properly, then we will have problems in our thinking, in our movement, etc. And so Alzheimer's disease affects the function of the neurons. It also affects the health of the neuron, with neurons gradually dying. And so one of the things that we see on MRI scans, for instance, are certain regions of the brain that have atrophy. And that atrophy is at a higher rate as compared to what you would have expected for the person's age.
Okay, one very quick last question, because we're getting short of time here, Fofi. Let's talk again about this Alzheimer's Day. You say it raises awareness, but I want to know what facilities we have in Cyprus to take care of these people, because with so many more elderly people beginning to show signs possibly of dementia, we need backup, don't we? And it doesn't seem to be very widespread in Cyprus.
Yeah, we do have an issue in Cyprus. We have an issue at the policy level. And as a result, we also have difficulties and great family burden. So, for instance, we do have a dementia strategy, a national dementia strategy, but it's not implemented adequately. So we don't have adequate government day centers, for instance, where people can go and participate in meaningful activities. There are some non-for-profit efforts. There are a few non-for-profit organizations that have created daycare centers for people with dementia, and families can participate in those. But the majority of the people are taken care of at their home without really adequate support.
So we have to finish this. We do really need to pressure, I suppose, the government, the health ministry and GSI, our National Health Service, to take this very seriously and implement some help.
Yeah, and implement prevention strategies. We have a lot of data and a lot of know-how as a research center on issues relevant to prevention. We have data from Cyprus. We have about 20% of older people, they seem to be at risk. Doesn't mean they have dementia, but they have risk factors that we are able to document. And there are things that we can do to increase access to services. And so I believe there should be a partnership between policymakers and academic institutions on how to implement that, and communicating to them and to the public is very critical.
Indeed. That is Fofi Konstantinidou, Director of the Centre for Applied Neuroscience at the University of Cyprus. Fofi, many thanks for your time.
Thank you.
This is the Cyprus News Digest with Rosie Haralambous.
Last week, the Minister of Transport, Alexis Vafiadis, said that he might consider lowering the traffic camera fines. He said €300 was half of a pension and that some old people might be going without food if they were caught running a red light. There's been a lot of conversation about the traffic cameras. There is no doubt whatsoever that they do seem to be cutting the casualty figures, which is great. But the Transport Committee at our Parliament was also discussing things that need to be adjusted, perhaps. And the chair of the Transport Committee joins us now. He is MP Marinos Mousoutas. Marinos, first of all, let's talk about what the Transport Committee was discussing, because I think you want some adjustments made to the system so that people are not caught out unfairly.
Good morning. I have to say that the Transport Committee is the third time that is discussing the whole theme about cameras, traffic cameras, since January 2021 that they were established in Cyprus. We discussed about how the system works, if there are any problems in the system, what's the result of the establishment of the cameras, first in Nicosia, next in Limassol, and now I think they're going to put new cameras in other towns in Cyprus. The third time that we discussed this thing was last Thursday. We discussed with the police and wanted the statistical results about how many penalties they had issued, and they said they had issued 172,000 penalties. From these, they were the people that were fined pay the penalty, 91,000 paid, and the rest, some of them were unpaid, and the most of them, around 70,000 fines, are in the procedure to go to the people that make the violation in order to pay. This is the first thing they said us about the cameras. The next thing that we discussed was some questions from the members of the committee, either from themselves or from the people that are discussing the thing, about the way that the cameras are working. We heard about the red light, and when I say about red light, I mean when you stop at the traffic lights and you want to go to the right, there is a small
a green arrow.
A green arrow, and many people say that this arrow first is green. When you proceed, it becomes red, and then it becomes again green. And this is the trap about the drivers, because they believe that in this case, when they pass from the line and becomes red, that they believe that this is a violation and that they have to pay a fine of 300 euros.
Basically, Marinos, can I just interrupt there? Basically, you're saying that, and I think we've all, if we drive around Nicosia, certainly, seen traffic lights which are not properly synchronized, is that the word, with the camera?
The people believe that this is happening. The police say, and it has a video too, that if the light is green and you pass the light, even it becomes red and then again green, there is no violation. This is that police say. But because people don't believe it, or people get fines believing that they have do this thing, we believe that the police and the ministry have to see again this thing. Maybe it's a problem in the system. Maybe they have to make an emergency and give the people all the information that is needed in order to convince people that the system is okay. This is the biggest problem that we have to discuss. And also, because of this, the 300 euros. We don't say the 300 euros that if somebody goes straight and goes, the light is red and goes all the way, the penalty is okay for the 300. But if it's something like that with the arrow, that is, somebody say it's correct and somebody says not correct, first they have to decide if it's correct or not, and then we say that police, we have fines for other violations, say about driving with the mobile, using the mobile, it's 150 euros. Driving without the safety zone, the penalty is 150 euros. If you make second time violation, the penalty goes to 300 euros. We say that we can do the same thing with the red light. If you make one violation to be 150, 100 euros, and if you make second or third or fourth violation, then to becomes 300 euros.
So do you agree with the minister that in actual fact the fines are overly repressive, if you like, for people who are on low incomes, and that they should be reduced?
Before I said to you a way that we can reduce the fine, but for the first time only, I say it's 300, go back to 150, and if you make again the violation, go against in 300. We believe that this is the proper way. We can't say that we can make the fines according to the income of the person that violates, because it's very difficult.
That's totally not. That's not workable at all, is it? But what about
this one?
What about all these unpaid fines, Marinos? Something like 40,000, and that's a lot of work for the police to go chasing around after people to pay a traffic violation fine.
Of course. This is unfair for the person who violate and go and pay the fine. The people who don't pay the fine, they do it because from the day that the post office give you the notification that you have a registered letter, and because people know that registered letter now is from the police, they don't go to get it. So the post office has to go 2 times. If you don't go, give it back to the police. The police try to find you. If it doesn't find you, go back to somebody else, and this goes and goes. This is unfair. They have to find a solution, even by an SMS on the mobile phone, everybody has mobile phone, to give you the fine immediately in order to know immediately that you made a violation, and if because of that you have 30 days, 45 days, I don't know how many are, in order to pay. This is one way to do it. The second way to do this is that maybe in the airports they make a data, and if somebody wants to go to the airport or to the port or goes to a police station for some reason, he can find it when he gives his ID in order to go away, or his passport. He finds to find him and say, hey, you have to pay a fine of 300 euros. You can't go away if you don't pay the fine.
Well, that's a great idea, Marinos, but the problem there is that we don't have a proper digitised government, do we? So you need to get the deputy ministry for that to link up all of these different databases, and they haven't done it even for the tax department yet.
So from somewhere we have to start. So it's one position that can help, and they have to put it in the strategic plan they have for the next year. Now have the budgets in 1 month, so I can put it in the budget for next year and start step by step to do this thing. Also, we have another team that is difficult to pay, is the tourist and the Z cars. And here they tried to make a law in order to make them to give the information to the police for the person that was driving the car, say a tourist, or for the person who was renting the car, maybe a Cypriot or a tourist, in order to give them the fine and to pay the penalty. This is some difficulties that we find them. Everybody agrees that we have to solve this, and I think with the push of the ministry and of the committee, they're going to do some steps in order to solve these two problems we said before.
Very quickly, I have one last question, and that is that I think at your meeting at the Transport Committee, you suggested that it would be a good idea to actually have a warning on the traffic lights to say, like, 6 seconds before it changes, because the other thing is, even if you're obeying the 50 speed limit, it could be that you're just 2 metres before the line, and if that's the moment that the light changes, you're going to get fined. Whereas if you can see a warning that says it's going to change in 4 or 5 seconds, you're going to put your brakes on and stop before the line anyway.
Yes, exactly. We said about this, and we think that it helps for the safety in the road, because if you see that the red light, it will change in 5 seconds, you'll be waiting the 5 seconds and then go straight. The police, unfortunately, the police say that they can't use this system. I didn't understand why they can't use it. I think that they can think about it again, and that if they put this system on the traffic lights, I think that many of the fines, many of the violations won't happen. I will speak with this thing again with the minister and try to find a solution, because I mean it's on the correct way and helps in the safety in the road.
It certainly does, and we've got those countdowns anyway already on some of the pedestrian crossings, so surely it's just a question of smart traffic lights.
I say about the pedestrian lines, you said, some people told us that in some pedestrian lines, the 10 seconds that they have in order to cross the line is too low, and that they have to increase it to 15, say, because if it's a road with 4 lines, you understand that 10 seconds is too low for somebody to cross the line.
Yes, they have to run across, don't they? And disabled people could not do it.
Yes, of course. And we ask them to please to check them and change them in order to be safety for a regular person to cross the line.
Well, we'll wait to hear what comes out of all of this, because there's no doubt that a lot of drivers, I think, feel that the government is just coining it in and collecting money for everything, whereas what we're really trying to do, I hope, is reduce the casualties on our roads.
I don't believe it, actually, personally, but we have to convince people that we are correct, and in order to convince them, we have to make the changes I said before.
Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.